Good day, this is Charles Celesta from BSN 12H. In this video, I will be performing a return demonstration on Leopold's maneuver. Leopold's maneuver is performed to identify the presentation, position, degree of descent, and attitude of the fetus, and also to identify the fetal heart tone in relation to the mother's abdomen. So before starting the process, we must make sure to wash our hands and perform hand hygiene to avoid cross-contamination. And after that we'll explain the procedure to the patient so that they will be aware of how the process will be. Okay, hello ma'am. My name is Charles Axel, your student nurse for today. So for today's session as we'll be doing the Leopold's maneuver. This process will be help us know the position of your baby, and with this I will be palpating your tummy and will also be doing auscultation. So before anything else, may I ask if you have emptied your bladder, or do you have perhaps feel like peeing? Okay, so since since our client is already comfortable position in a supine position with a pillow in her back, we'll now start with the process. So since I am right-handed, I will be standing on the right side of the patient and for easier access to the fundus. So for the first maneuver, while facing the client, we will palpate her uterine fundus, or the upper area of the tummy. So this is for us to determine which part of the fetus is the upper part of the client's uterus. So now I am going to palpate it. So palpate it gently. Okay. So now, for the second maneuver we'll palpate in the downward direction on the sides of our abdomen, on the client's abdomen. So here we'll have to apply gently but deep pressure for us to determine the position of the fetal extremities and its back and anterior of front shoulder. Okay, now I am going to palpate it. Okay, so moving on our third maneuver, this time is using our right hand, we'll palpate over the symphysis pubis. So here we'll gently grasp the lower uterine area between our thumb and the fingers to feel which part of the fetus is in this area. Okay, so now I am going to hold my right hand under this her abdomen and left hand to the upper to assist. Okay, just gently grasp it. Okay, so usually for the normal fetal presentation, we should be feeling the head of the fetus while palpating the area. Okay, now, so for the fourth and the last maneuver, we'll turn and face the client's feet and then palpate to perform findings of the third maneuver. So while doing this, we'll also have to determine the flexion of the uterus. So now I am going to perform it. Okay, so here we're nothing if the fetus is in the vertex presentation or the full flexion, or if they are in face presentation or full flexion. So now after the four maneuvers, we'll now try to listen the fetal heart tone using our stat. So first, we'll locate the back of the fetus. So earlier, while doing the palpation, the fetal back was at the right side of the mother's abdomen, and now we'll place our stet over it and then listen for the fetal heart tone for 1 full minute. And while listening, we'll note for the location and the rate and also the character of the FHT or the fetal heart tone. And now we're done with the procedure. We'll now assist our client to sit comfortably. Okay, ma'am. Can you sit? Okay. 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 And after that, now we're done. So we're going to perform a hand hygiene. Okay, ma'am. So after everything, we'll now document the observation we have for this procedure. So here we'll document important details like the fetal presentation, position, and the attitude.